everyone, my name is Hannah Holly, and this is my speech number 2, Informative Speech on Lupus. Can you imagine being tired all of the time, no matter how much you sleep or what you do? My mother can. She struggles from lupus. What is lupus exactly? Lupus is a chronic autoimmune disease that virtually none of your organs are safe from. It can range from mild to life-threatening in terms of seriousness, depending on the type, and the people who suffer are typically diagnosed between the ages of 15 and 44. Actually, 90% of those who are diagnosed are, in fact, women, according to Marissa Laliverte in her 2019 article. We will discuss the different types of lupus, the different symptoms that you can get varying from person to person, and we will also discuss the different ways to diagnose and to treat lupus. My mother struggles with lupus on a daily basis. I have come to realize that I was unaware of exactly what lupus was and what it entailed, and a lot of people about it as well that I didn't even know until my mother was diagnosed. So, this is my way of educating myself even further and others as well. So, first, we will discuss the different types of lupus. There is systemic lupus erythematosus. Systemic lupus erythematosus is the most common and the most serious form of lupus, according to the CDC's Lupus Basics site in 2018. This affects all of the parts of the body instead of only certain parts. It is really unknown what causes this form for sure, but a lot of people think that it could be environmental factors that could play a big role in it. The second one we will discuss is cutaneous lupus erythematosus. This affects the skin, and according to Rita Palehesde-Costas in her 2018 article, it can be severe and it can be treatment resistant, so it's kind of hard to deal with. The third we will discuss is drug-induced lupus. Rubin in 2020 had put out an article claiming that drug-induced lupus is a side effect of long-term usage of up to 100 different medications. You can be genetically predisposed to drug-induced lupus, according to Rubin, but it is most commonly the fault of the dosage and the duration of the medicine. So however long you take it and how much you take at a time is a big contributing factor. So the final and the most rare form actually is neonatal lupus. This is very rarely seen and it affects newborn babies. Lee, in her 2016 article, writes that this is caused by the autoantibodies passing from the mother to the child through the placenta. So next we will discuss the wide variety of symptoms of lupus. This varies from person to person, and this is one of the many reasons that it is difficult to diagnose lupus because there are so many different things that could be other things. So you can have muscle and joint pain. This causes pain and stiffness. This is commonly in the neck, the thighs, the shoulders, and the upper arms. You can often get a fever with it, but a high fever. It's always going to be over 100, and this is caused from the inflammation and from the infection that lupus brings about. So, one of the most important ones, and one of the biggest ones that I've noticed, particularly with my mom, is fatigue. Fatigue can be a sign of anemia, which is, according to the Lupus Basics article, is a lack of red blood cells. So this often causes people can be anemic without lupus, and this causes people to be tired as well. So on top of everything that already causes fatigue with lupus, this can be very rough to deal with. It is a sign of a flare, in fact, fatigue is. So lupus is a flare disease. It is not always present in terms of symptoms, but it can flare up and worsen at different times. So fatigue can also be a sign that a flare is about to occur. You can experience hair loss. This can be from medicine or infections that you're taking to help treat your lupus, but it can also be caused by the anemia that you're experiencing with the fatigue and everything. So rashes. Rashes are a very big staple when you think of lupus. You can get them on your shoulders, on your arms, on your legs, and this is a lot in terms of being caused by the sun and light sensitivity. Many with lupus have photosensitivity, according to the Lupus Basics page from the CDC site. This causes the rashes and the fever and the fatigue and is the big factor in it. Honestly, the most common is the butterfly rash in terms of rashes for lupus. A lot of people, when they think of lupus and rashes, they think of this butterfly rash. It is a rash that occurs all the way around the cheeks, up into the nose, in almost the shape of butterfly wings. So this is a lot of a big tell sign whenever you think of lupus.